Welcome back to Passion for Palliative. My name is Ann Curry and I am a physician assistant and I work in palliative medicine. Today's topic is going to be a brief topic on a communication skill. This will help nurses, CNAs, NPs, PAs, anytime you're making a phone call, perhaps to a physician on call with a situation that you need assistance with. So this is a way to get prepared ahead of time, really with the goal being clear communication and a safe plan for the patient. So first you start, when you call the person, always identify yourself. What is your name? What is your role? Where are you calling from? You may be calling, for example, a nurse. You might be calling from a hospice house. Identify who you are and where you're calling from, because the person that's on call, they might not know you and they might not know the patient. After that, the first thing to do is to describe the situation. So this should be a clear, concise statement. You might say, for example, Mrs. Jones is an 85-year-old woman and she was admitted to the hospice house last night and she's been having nausea for the past 4 hours. General situation. The next thing you want to do is describe the background. And again, you want to have all of this information in front of you when you call. So the background to this, you might include things like her vital signs, what are her symptoms, what are her other comorbidities, what is her physical exam, any findings. So you can think of this more as your objective findings. And you want to have all of that ready ahead of time. The other things you might want to include are medications, medication changes, and medication allergies. So in this example, you have a woman who has been having nausea for the last 4 hours, and you might also include some background like she has stage 4 lung cancer, she was admitted to get her symptom of shortness of breath under control, and she's been taking escalating doses of morphine. And now you may add some other background, for example, that she has not had a bowel movement in the last 4 days. That might be something else you add. The next step is your assessment. So you have great clinical skills and it's really important to use them. So you might say something here like, I think that Mrs. Jones is having nausea due to constipation. She was recently started on morphine and we've been giving her higher doses and she hasn't had a bowel movement. So that's your assessment. Next is your recommendation, which you could also call your plan. Here again, come up with a clear, concise plan. So for this patient, you might say, I really think that we need to start this patient on a bowel regimen and I recommend these medications. I also think that she needs a medication for nausea. I'm thinking, for example, I'm thinking Zofran. And what are you thinking? So you can then propose your recommendation to the physician on call and then have a discussion about the recommendation. So they might say, that sounds like a great plan. They might say, you know what, I think we should use this medication to treat this instead, or they may need more information. At the end of the call, it's really important to repeat the plan back to them so that you are very clear about what the plan is. And it's also important that you're comfortable with the plan. So if there's anything that you're not comfortable implementing about the plan, that's the time to say that. And again, this is just a really simple way to have all of your information ready ahead of time before you pick up the phone to call.